Thank you for joining us today. So this webinar is about addressing self-regulation challenges using horticultural therapy and therapeutic horticulture. My name is Beth House, and I am happy to be your moderator today. I am with the Nova Scotia Horticulture for Health Network, and I work with the Nova Scotia Alzheimer's Society, and I'm the Dementia Friendly Communities Lead here. I'm located in Halifax today. I'll be moderating the presentations. We are taking questions. You can put them in the chat box and I will be addressing them at the end. We'll hold them. So please put them in the chat box and we'll get to them at the end. So thank you very much for joining us as we explore self-regulation and its application using horticultural therapy and therapeutic horticulture. I'm joined today by Lesley Fleming, Maureen Bethel, and Tasha Roberts. So Lesley Fleming is a registered horticultural therapist leading the Florida Horticulture for Health Network and the Nova Scotia Horticulture for Health Network. She has worked with a range of populations delivering therapeutic horticulture. Her recent work has included collaboratively establishing the Therapeutic Horticulture Activities Database, presentations on developments in HT and Horticulture for Health, writing articles for the network's e-publications on a wide variety of topics from school gardens, university students, nature engagement, and therapeutic horticulture used with female survivors of human trafficking. Maureen Bethel is currently the manager of Daybreak Parent-Child Center Community and Parent Programs in St. John, Newfoundland. She has degrees from Vanier, Concordia, Memorial University of Newfoundland, and St. Xavier University in the fields of social studies, geography, education, elementary, secondary, and post-secondary, as well as adult education. Maureen has worked in the field of community capacity building with focus on early learning and working with the complex needs of families for over 22 years. She has extensive experience in supporting young children and families through the strength-based holistic programs nested in neighborhoods and community at large. Maureen is currently pursuing professional development in the field of horticultural therapy. And we have Tasha Roberts. Tasha is a private therapeutic horticulture practitioner, entrepreneur, business coach, and a trainer based in Newfoundland, Canada. She has spent the last 20 years helping businesses, people, and plants grow. Tasha graduated from the University of Guelph as a horticulturist and trained in mindfulness core concepts. Her experience encompasses community wellness, mental health, and addiction support groups, and the incarcerated population. She focuses on developing community therapeutic horticulture programs to empower individuals to cultivate stress reduction techniques, self-regulation, and overall health and emotional well-being. Tasha is a membership committee volunteer and is pursuing professional registration with the Canadian Horticulture Therapy Association. So the presentation is based on a paper that was published in the Journal of Therapeutic Horticulture by our panelists in 2023, titled Self-Regulation, Its Neuroscience Foundation and HT, Growing the Connections. The webinar will be covering topics that really need much more time and years of experience. The ladies have tried to synthesize concepts and present key ideas for you to investigate further. Lesley, would you please start us off?
Certainly. Thanks, Beth. So, self-regulation is defined as an individual's processing of sensory, biological, neurological, environmental, and societal inputs to interpret and manage thoughts and behaviors, emotions, and neurological, physiological responses to the world around them. This very complex web of inputs involves multiple biological systems. It involves the brain, emotional intelligence, learned behavior, and social norms that present as an individual's planning and executive functions, as their choices, their impulses, thoughts, emotions, and overall societal behaviors. Self-regulation is a health challenge experienced by individuals and populations across the lifespan that can impact relationships. It can impact safety of the individual and the community and the ability to function in society. Challenges to self-regulation manifest in many ways based on an individual's neurodiversity. Self-regulation that is considered positive and healthy involves the individual balancing inputs and conflicts, impulses, and social norms to respond in a manner appropriate for the situation according to accepted rules of society. And current health practices identify self-regulatory failure or dysregulation as contributing to social and mental health challenges related to a wide range of problems, including obesity, addiction, poor financial decisions, and sexual infidelity, as well as social exclusion, poor self-esteem, and lack of resiliency in coping with adversity. Self-regulation issues can be broader than behavior and can, for example, involve physiological components that have been linked to cognitive impairment, inflammatory disease, digestive and respiratory issues, impaired immune functions, chronic fatigue, depression, and anxiety, among others. Now, the complexities of self-regulation involving brain functioning and neuroscience components continue to be investigated across disciplines. Neuroscience-based theories discuss autonomic nervous and limbic systems where neurophysiological processes and neuroanatomical structures are involved in processing of inputs. Polyvagal theory and its hierarchical model of self-regulation dependent on survival-focused systems embedded in the brain stem and autonomic nervous system understands multiple brain regions playing a role in self-regulation. Now, to express that slightly differently and perhaps simplifying this, the autonomic nervous system listens to all input, causing reactions by the dorsal vagal, which is responsible for retreat and shutdown. That's how it's sometimes described. The sympathetic pathway, which is referred to as fight or flight component, and the ventral vagal, and that deals with the state of balance and well-being. So maybe picture this: a ladder with the dorsal at the bottom and the ventral at the top, and then the sympathetic in the middle. So the polyvagal theory is based on an individual's movement up and down the ladder throughout daily interactions multiple times. So polyvagal theory seems to have broader acceptance within the medical and therapeutic communities, though some consider it nascent, continuing to emerge. So Maureen, can you provide us with a bit more information? Okay, you're muted, Maureen.
Somebody muted me again. I will try. Thank you very much.
Perfect.
So
now.
Current scientific research identifies multiple inputs, both neural and external stimuli, that impact and influence behavior, thoughts, and emotions. The literature mentions the concept of psychophysiological parallelism, a mouthful, but it's where both the psychological, which is the mind, and the physiological, which is the body, actively work concurrently to self-regulation. So they work together. We'll just expand a little bit more on the neural connection and its impact on self-regulation. It might cause changes in mood, arousal, drive, and motivation responses when the dopaminergic tracks are imbalanced. So again, if it's not in balance, it will not be giving a good response. So what you have is this is critical to self-regulation, reward systems, because dopamine is part of our reward system, or actively related to threats. Again, going back to what Lesley said, that fight or flight response. The executive function, emotion and reward trigger cues, reactivity, visual stimuli, lapse, and other activations are central to self-regulation. For example, resisting temptation. The inability to self-regulate can lead to misguided and misunderstood in processing of the neural and external stimuli, possibly leading to addictive behavior, as seen in obesity or substance use, negative mental health outcomes, and criminal behavior. Detecting and evaluating risk, regulating that fight or flight behavior also regulates adaptive defense behaviors and autonomic states. So can you walk away or can you not? So it really responds to that. Finding strategies to support healthy self-regulation across the lifespan in an ever-changing complex society is challenging for individuals and health professionals. We all have to learn self-regulation. Evolving work in the field of neuroscience and neurobiology is demonstrating the need for an individual's brain function to be in balance. So again, that mind and body is an important concept in self-regulation. Again, we're looking at balance, always coming to balance on the ladder. There's multiple theories that address self-regulation, including Perry's tree of regulation, which you'll see on the slide, or Siegel's window of tolerance, the process model of emotional regulation framework for identifying adaptive and maladaptive responses to stress and trauma. So these are two of the main theories that we see. And the theories and how we use them is using and developing towards strategies, hands-on strategies that we can use every day. So strategies to support healthy self-regulation include mindfulness, distraction, avoidance, venting, commitment to building skills, acceptance, cognitive change, building adaptive skills, and many others that are out there. And I'm sure you can all think of something to add to that list that's in front of you. So horticultural therapy as a modality grounded in therapeutic process, using hands-on plant activities, addressing therapeutic goals with measurable outcomes, along with the design of a therapeutic environment, offering safe spaces, physically, psychologically, emotionally, and spiritually within HT, is being incorporated into health services addressing self-regulation across the lifespan. It is particularly versatile across the generational spectrum and with all types of health challenges, because self-regulation is a lifespan commitment and a learned behavior. So the current HT literature and research is really limited on the topic of self-regulation, though its health component impacts all aspects of human functioning. Our Journal of Therapeutic Horticulture article is hopefully the beginning of further insights and research on the topic, because we really do need it. And I think we do apply it. We just don't have enough information in the science world. The field of horticultural therapy is expanding its awareness in several areas directly related to self-regulation. And those topics are, and the concepts are, neurotypical, neurodiverse individuals, interventions using neurosequential and neurodevelopmental approaches, including a deeper understanding of sensory inputs and the autonomic nervous system responses, and integration of the polyvagal theory, which Lesley mentioned earlier. One significant area of self-regulation dysfunction is social interactions. Horticultural therapy can be used to address deficits, to promote positive social engagement, including a sense of self, awareness of others, feelings, and connection to others, including healthy attachment. Tasha, can you talk a bit more about HT applications as strategies for self-regulation? Hand it over to you.
Sure, absolutely. Thank you, Maureen. So horticultural therapy, like other therapeutic modalities, deals with a variety of maladaptive behaviors. such as excessive, impulsive, or hypervigilant behaviors. Horticultural therapy interventions focused on coping strategies, improving receptivity of inputs, practice shifting internal distress to external inputs, modeling calm, measured behavior, and fostering sense of well-being, optimizing integration of brain and mind functioning are within the scope of this discipline and can be expected to grow with increased awareness. The delivery sites of horticultural therapy, including plant-rich green spaces, gardens, greenhouses, and natural landscapes, can be effective in contributing to restoration, calm, and a sense of safety, all identified as significant elements for improved self-regulation outcomes. The explicit sensory component of horticultural therapy and plant-based activities support self-regulation interventions, targeting the management and integration of appropriate responses to sensory inputs, aligning brain inputs, improving communication, and managing misunderstood cues, and enhancing emotional regulation of contentment, soothing, and social safeness. So an examination of specific populations sheds light on how horticultural therapy can address self-regulation challenges. Analysis by population can inform practitioners on this topic. It is recommended that medical precautions be followed as advised by a client's physician prior to engaging in an activity which could have significant impact on cardiac, vagal nerve, or other psychological systems. And now onto the applications for special populations that may have self-regulation challenges. So we three panelists here, Lesley, Maureen, and myself, as mentioned, we have a variety of experiences delivering horticultural therapy and therapeutic horticulture within these populations. The ones that we're going to touch on today, there's certainly more, but we're going to focus on kind of some specific areas that we are most versed in. And we're ready to share some of those insights in this segment with a discussion with the three of us, so touching on several of these populations. Lesley, why don't you kick us off here with autism, self-regulation, and people living with an autism spectrum disorder?
Great, thanks, Tasha. So autism, defined as a developmental disability caused by differences in the brain, is mentioned in self-regulation literature as individuals having challenges processing neurological, sensory, and other inputs. Now, each individual has unique strengths and challenges, these related to self-regulation, so assessment is critical to any strategy, horticultural therapy or other, that seeks to address challenges. Some behaviors that may be present: impulsivity, sensory defensiveness, dislike of tactile or other sensory experiences, as well as spinning, maybe difficulty with social interactions. I think many of us are familiar with these. So translating these into horticultural therapy or therapeutic horticulture interventions, identifying goals like increasing tolerance for non-preferred activities, or self-selecting appropriate sensory breaks, or maybe practice swinging or bouncing or spinning, or brushing to regulate sensory response. That's where you would touch the skin and brush, a soft plant. These can guide practitioners in finding appropriate plant-based activities for working towards outcomes that improve social functioning and well-being. Now, for example, offering a choice of filling containers with soil or watering plants for increasing tolerance for non-preferred activities gives you some ideas of the activities that we can incorporate.
Lesley, are there particular HT or TH programs for people living with autism spectrum?
Yeah, that's a good question, Maureen. Thanks. And my answer is yes. Now, these are typically health services, or they're at schools and wonderfully at botanical gardens. And here's a few examples: Fairchild Tropical Botanic Gardens in Miami, Florida, the Missouri Botanical Garden, the Huntington Library, Art Museum, and Botanical Garden, that's in California, and the Cincinnati Zoo and Botanical Garden in Ohio. offer interesting resources. Now, these are primarily recreational in focus, where the facility has tried to be sensitive to challenges this population may experience. And these are mostly sensory challenges and structured time in the garden when it may be quieter, identifying quieter parts of the garden, and provision of written materials in support of a fun green space and visit. So perhaps you're familiar with ones in your local community, which is wonderful to see these expand.
And Lesley, how else might horticultural therapy and therapeutic horticulture be incorporated into programming for people living with an autism spectrum disorder?
Right. Horticultural therapy goals, and sometimes we express these with this population and others as sensory processing and integration goals, include working cooperatively with others or responding to school and other environments appropriately, interpreting cues or directions or peer comments, and integrating sensory inputs. Therapeutic horticulture activities addressing these goals include gardening tasks like mixing soil and planting seeds as individual or group activities. The latter would be focused on promoting and practicing social interactions, which is kind of the focus that we're talking about right now. Now, horticulture therapy programs have been used to improve emotional intelligence of school-aged children living with an autism spectrum disorder. And we know that this is part of self-regulation. Bila and Thankapan's 2021 paper, Enacta Horticulturae, discuss this aspect. So that's listed as one of our citations. So Maureen, I'm going to shift it over to you. Can you talk to us about the next population, one that you work with, children at risk in early years?
Thanks, Lesley. And certainly, and if you just take a glance at the slide, you'll see that 9.1% of children live in poverty. And as a social determinant of health, that's significant. So it increases the risk with regards to self-regulation and many, many other things. And the same with, and it's particularly if you are a single parent, female, it rises dramatically. It's well established across disciplines that birth to age 5 is a rapid growth and development for children. Lived experience during this period shapes the overall neurological brain development, including self-regulation and self-control. And this stage really represents one of the most important turning points across the life courses. Self-regulation in children undergoes continuous rapid change. Their brains are developing so fast in their bodies. Children living in poverty within the early years have an increased risk for what Palachois, Burroughs, and Hansen describe externalizing, which is aggression and delinquency, and internalizing, which is where they regress into depression and high anxiety symptomologies. So there's two that can go there, which can be observed as maladaptive behavior, misinterpretation of social cues, not understanding which way to go, and a lack of impulse control. It pops in their head and they do it. Developing therapeutic interventions that foster resiliency in children to further strengthen their self-regulation skills really has the potential to mediate adverse child experiences, which is commonly known as ACEs by many people with regards to the huge study that was done in the States.
And Maureen, what are the key therapeutic goals and horticultural therapy, therapeutic horticulture interventions for this particular population?
Oh, good question, Tasha. The horticultural therapy as a modality presents a really great opportunity to work with children in a really safe, nurturing environment and nature-based, which is really good for children. Garden or plant-based therapeutic horticulture can include digging in the garden, weeding, moving plants from place to place, which all use motor skills as well as decision-making. They also balance the mind and body, and you work through problem solving, and they do it concurrently, which is really essential to, again, that self-regulation. Going back to what we've talked about already moving forward is always having a balance within there to be able to stay on that ladder in the middle. For example, planting seeds is a really mindful activity, a tuning of the mind and body. You're concentrating on these small seeds and putting it in. So you're using a lot of fine motor and gross motor. And it's a very good self-regulation tool that can help an individual move into balance because they're going into that ventral vagal zone and they're really resulting in a really nice state of health and well-being. It's like that meditative calming. If a child is like lack of impulse and they're bouncing around, it might be a way to like bring their focus somewhere and then see their muscles relax and then come down.
So is horticultural therapy and therapeutic horticulture broad enough to address a range of self-regulation challenges that young children have?
I think so. And research by Diamond and Lee showed that aerobic exercises, motor skill development, mindfulness practices really resulted in improved executive function for 7 to 9-year-old. A little bit more of a higher age group, but that was the group that was available. There are opportunities to do younger children, I think. Programs like what we would run, Little Veggies, which we do here, and Farm to School, which is ongoing, have been effective in treating and helping children develop self-regulation skills that become crucial in subsequent stages of life because they have to come in and they come in all excited, they can run around and use their energy in Little Veggies, but then they have to focus on something. So they have to listen, they have to see, they can play and manipulate. So I think that's important. I think there's lots of opportunity. Lesley, you're at the other end of the spectrum from me, literally, so across the lifespan. And maybe you could give us some of the information about the seniors and dementia population. In particular, what are the self-regulatory challenges that this population faces?
Great, happy to do that. Now, self-regulation challenges among senior and dementia populations span a wide array of behaviors and health challenges. And we like to always turn to research, which suggests that age can be a factor in emotion regulation, which is a key component of self-regulation, as is self-awareness. So the implications of research, and Reed et al. Suggests this, older adults may rely less on neurobiological resources and more on practice and experiences for self-regulation efforts. So this is specific probably to this population. People living with dementia with diminished cognition impact the ability to regulate emotions and decision making, according to research by Williams et al. In 2018. So even though we today are using some categories and referencing whole populations, we all know that, individuals really comprise the populations, and we have to look at each individual, but there are some commonalities.
Lesley, what behaviors are associated with self-regulation dysfunction that might be evident in this population?
Right. I would probably suggest disruptive behavior, inappropriate responses, vocalization, and some of those outbursts might be used as self-stimulation, and responses to pain exhibited by seniors, and I would say more often by people living with dementia. They're going to have less inhibitions typically, and so they would respond to brushing up against a rough shrub or knocking their knee on a chair.
And Lesley, I'm curious from your perspective, what therapeutic goals and activities related to self-regulation might horticultural therapy and therapeutic horticulture use for seniors and people living with dementia?
Right. Well, for sure, sensory stimulation, and that would be for compromised cognition, but also used for intellectual stimulation. And for those of you who have worked in, say, memory care facilities, there may be a couple, and one of the partners has cognitive decline, the other one perhaps not, or some people are going to have more cognitive decline than others. So it is used for both compromised cognition and for intellectual stimulation. And then we are going to look for coping strategies for misinterpretation of cues and plant-based activities promoting appropriate behavior for social interactions. So I would say therapeutic horticulture activities, the ones I'd suggest include celebrating holidays with plant themes, and that could include and be related to therapeutic goal of distraction from pain. Another idea, reminiscing using plant prompts like summertime watermelon or oranges and Christmas stockings. Oh, am I giving my age away here? Maybe. Taking turns watering plants, and that could be related to the goal of practicing appropriate behavior or calming others who become agitated over delays or reactions to vocal or behavioral aggression or disruptions. And one of the things that we also include is increasing physical exercise by walking in a garden, touching and smelling plants. That would be, sensory stimulation basics. So I am sharing these photos of painting a rain barrel. And this was one of my programs. And what we did, we used easy shapes of hearts, focusing on taking turns and working together, socializing in the garden during the activity. And this was a memory care facility. Now, when a resident was disruptive or may become disruptive to others, vocalizing or grabbing others, they were or can be moved to out of the group to watch and then worked with the therapist one-on-one. So that seemed to be a good strategy that I found effective. Horticultural therapy interventions are more often delivered as therapeutic horticulture for senior and dementia populations. I think I'm not amiss in saying that in North America anyway. And then programs addressing self-regulation challenges focus on often mediating social behaviors related to communal living at senior facilities during plant-based activities. So I want to ask Tasha about our next population. Can you tell us about self-regulation challenges for people who are incarcerated?
Absolutely. Thank you, Lesley. I love that picture. I don't know if I've ever expressed how much I love that. Your water barrel. That's gorgeous.
Thank you.
Okay. So the incarcerated populations are complex and multidimensional. And what I mean by that is that this marginalized population faces a dynamic set of diagnoses that often contribute to criminal behavior and likely influence the probability of recidivism. A holistic understanding of the presenting diagnosis, including behavioral implications relating to self-regulation, will inform the approach to rehabilitation and strategies for addressing the behaviors that present themselves when interacting with other inmates and staff in the correction settings. Prevalent mental health challenges among incarcerated people include childhood trauma, sexual trauma, stress-related disorders, personality disorders, developmental disorders, including fetal alcohol syndrome disorder and attention deficit hyperactivity disorder, neurocognitive impairments, and substance use. And there's a high incidence of substance use or misuse in mental illness across this population, often rooted in past trauma, especially when the trauma was experienced in early childhood. So these impact development of traits like empathy, which is a necessity for self-regulation. So trauma often presents during incarceration, but the prisons themselves are actually a site quite often of new trauma, which is really interesting. So further exposing violent and traumatic experiences, the inmates. Interesting research from Leichhardt et al. That suggests brain function connected with self-regulation declines after 3 months of imprisonment. That's pretty staggering when you think about that for a second. So already this population, individuals, tend to show up with challenges around self-regulation and everything we just mentioned. But throw in the fact that when they enter the corrections environment, within 3 months, there's a decline in that brain function. That stat always gets me. So this is, of course, too big of a topic to provide much detail about, but this is an important factor for this population, self-regulation and horticultural therapy interventions.
So what aspects of self-regulation should HT practitioners consider when developing programs for incarcerated people, Tasha?
So horticultural therapy programs are being used within correction environments right now to address a variety of health challenges. They vary considerably within the prison systems and across and internationally, and include things like vocational horticulture, landscaping programs, working firms, formal and informal horticultural programs, as well as formal and informal therapeutic horticulture programs as well. So horticultural therapy programs address elements of self-regulation like social cognition, emotional stability, and mental health, and focus on behavioral challenges common in incarcerated populations like anxiety, depression, and aggression. So the development of horticultural therapy programs in conjunction with other interventions, including substance use treatments and psychological supports, can increase the overall effectiveness of the practice of horticultural therapy for this population.
Tasha, how would HT and TH address anxiety, anger, and aggression, and those manifestations within self-regulation within your population, particularly self-regulation dysfunction?
Yes, okay. So therapeutic goals within horticultural therapy can assist with the development of self-soothing approaches for symptoms of anxiety and panic, self-control mechanisms to build healthy anger and agitation management behaviors, and coping strategies for stressors while incarcerated and at post-release. And that's significant for this population. Aromatherapy, so jasmine and other fragrances can have diminishing effects on an overactive sympathetic nervous system, known to be involved in neurophysio responses associated with self-regulation. Plant-based activities aligned with these therapeutic goals might include physical exercise, such as working in the garden through activities like digging and weeding, and can help manage stress, anger, and agitation responses. Additionally, a mindful garden practice that engages all 5 senses, visualization, exploring nature-based photographs, can be beneficial for those who do not have access to the outdoors. So these techniques can help reprogram the body's stress response and provide all the benefits of traditional meditation, but in a more accessible way for individuals who may find still meditation challenging. So I think that's really important to highlight here for this particular population, is that quite often when these individuals show up to a session, there's a lot of anxiety just coming in to the session itself. So working with a more active meditation, like the digging, different movements, that can still serve the population in receiving all the same benefits, except it works really well with individuals working through anxiety, where stillness, for example, can actually increase anxiety. So that's where nature and nature-based activities can really help with that piece. So when used specifically at the beginning of each session, this is where we can significantly impact the session's direction, particularly for inmates who often arrive in a fight or flight mode. And what I mean by that is by placing some of these activities, these mindful-based activities at the top, what happens is you've got, again, most individuals, most inmates coming into a session are in a flight or fight state. That's just the fact of the environment. If they're in freeze, they're just not showing up, but they're often coming in fight or flight. So you can imagine coming in and starting a session, if we don't have a way to kind of bring everybody out of some of these feelings, the anxiety, the agitation, these are all common traits that show up in the room or outside. If we don't work with that at the beginning, the direction of that session, from my own experience and what I've seen, is drastic. So it's really interesting to kind of think about where we even place some of these activities and the population that's involved. Because for sure with this particular population, it really matters.
Okay, so we're going to move on to self-regulation for veteran and active military. And I think that's one of my populations. So I'd like to say self-regulation challenges identified with veteran and active military populations are related to stress or post-traumatic stress disorder and hypervigilance. And these are often associated with, for example, difficulty shifting internal distress to external inputs or modeling calm, measured behavior, fostering sense of well-being, optimizing integration of brain and mind functioning, and sadly addressing suicide ideation, to name a few. So understanding the neural multifaceted self-regulation processing that individual military members experience sheds light on therapeutic interventions which may be effective. And horticultural therapy is one such modality that is addressing these health challenges. So, for example, in this context, structuring therapeutic activities akin to military missions. And what I mean by that, the goal or the cycle of harvesting a crop, including planting and tending plants, requires ongoing attention and regular physical activity. Or another example, a group activity caring for plants, promoting with a specific focus, social interactions, vocational HT programs with the same population or growing plants. And then one that I found particularly interesting because I think it's relatively new is a meditative self-reflective physical activity as seen at Green Road Walking Path in Bethesda Healing Garden. And that's at the Walter Reed National Military Medical Center in Maryland. Research by Detweiler et al. Investigated outcomes from horticultural therapy in the neurophysiological modulation of cortisol levels, PTSD, and the quality of life in veterans. So there are some studies and research happening, but of course we need more. Speaking of Moore et al. Examined HT's impact on veterans with history of suicide. That was research done in 2021, so fairly recently. And research really has identified nature-based interventions as alternative strategies for addressing veteran and active military challenges. These often are a component of horticultural therapy. So understanding the multifaceted neurobiological, psychological, and physio-social factors, self-regulation processing that individual military members experience sheds light on therapeutic interventions, which may be effective, like horticultural therapy and nature-based therapies. So as I think you've seen in this presentation, each population has some self-regulation challenges specific to their experiences. And there are some commonalities like calming the sympathetic system. Now, I think one of the next steps for HT and self-regulation is expanding the knowledge and the integration of the modality into HT services and improving goals beyond. Sometimes we state goals as improving coping skills. I think maybe we want to be a bit more specific. And these are, of course, important, but perhaps not as thorough as integration of neurological factors and goals. So this may require, and I'm hoping other health professionals from other fields will begin to interact and share their knowledge and expertise with the HT field.
So, in summary, the very complex nature of self-regulation and its role in all aspects of human functioning makes it an important topic for health practitioners across disciplines, including horticultural therapy. So horticultural therapy can be impactful for self-regulation challenges across populations because its foundational elements can align with treatment of self-regulation dysfunction, offering applications that can be dynamic, kinetic, sensory, somatic, or a combination of all of these. Expanding the awareness of self-regulation and its neuroscience foundations within the horticultural therapy field will expand and elevate theory and practice in particular understanding polyvagal theory or polyvagal informed interventions, which presently have widespread acceptance within the mental health field. So for information on polyvagal theory and polyvagal informed interventions, there's a lot of great books out there right now. One to consider would be Pogue's and Dana's 2018 book, Clinical Applications of the Polyvagal Theory, The Emergence of Polyvagal Informed Theories, and Dana's 2018 book, The Polyvagal Theory in Therapy, Engaging the Rhythm of Regulation. And of course, the wonderful Florida Horticulture for Health Network and the Nova Scotia Horticulture for Health YouTube video, Need to Know Developments in Horticultural Therapy and Horticulture for Health, has some really great resources in that video as well. So the selected bibliography references the citations mentioned in this presentation based on the Journal of Therapeutic Horticulture paper in 2023, Self-Regulation, Its Neuroscience Foundations and Horticultural Therapy, Growing the Connections. So we're going to go through these slides fairly quickly so that you know the information is here. And if you want to look more thoroughly at them, you can certainly, when you receive the recording of the video, you can kind of pause and go through that. We did make great effort to reference science-based empirical research in our horticultural therapy and Hort for Health work. And many of these references are listed, of course, in the journal article that we all wrote.
Right, Tasha, I see the link to the YouTube video, Need to Know Developments. I think that's an active link.
Oh, great. Yes. So many great resources here.
Right, I see Porges. He's, as you said, an expert in the field. And this is the last slide with the citations.
Okay, well, I think that concludes our kind of side of things. So I wanted to thank you for your interest, all of you. There's a lot of you, which I'm so excited about, to see so many people interested in this topic of self-regulation and using horticultural therapy and horticultural health to address this challenge. I want to thank my absolute amazing co-presenters and co-writers, Maureen and Lesley. Thank you so much. It's been an honor to work with you through this and the journal article. And here's our contact information. So if anyone would like to learn more, reach out, please, to any one of us about the populations we work with or the topic. We would love to hear from you. And then, of course, we would not be here today without the Florida Horticulture for Health Network and the Nova Scotia Horticulture for Health Network. And if you haven't, which I think some of you are here because of it, if you have not checked out the absolute beautiful resources these two groups provide, please do so. And that's my own plug. I think it's an absolute wonderful resource that I use as much as I can as well.